In section number 1, bacteria, the family Mycobacteria, today we will discuss about Mycobacterium leprae. If you have not watched the video of Mycobacterium tuberculosis, go back and watch and then continue the series of bacteria. In this video, we will discuss Mycobacterium leprae, which is acid-fast bacillus bacteria. Acid-fast bacillus bacteria are those bacteria which have mycolic acid in their cell wall. And these are bacilli shaped, means rod shaped bacteria. These bacteria cannot be grown in laboratories and neither can be cultured in laboratories. Reservoirs are armadillos, which are animals, and the host primary are humans. And transmission can occur through nasal secretions and skin lesions of those persons who have already infected with the Mycobacterium leprae. There are the two types of leprosy, means two forms of leprosy. One is tuberculate leprosy form and other one is lepromatous form. The tuberculate form is also known as the pasobacillary because of its less severity. The body shows strong immune response towards this type of form and the T helper type 1 cells are activated and this is less severe. One of the important thing that clinical picture of this tuberculate form leprosy is hairless skin, black hypopigmentation of the skin, as you can see in the picture. Lepromatous form of leprosy. It is more severe form of leprosy where body show weak immune response towards the infection. The clinical picture in this form of leprosy is leonine faces, where there is the thickening of the facial features. The face resembles like a lion. The lepromatous form of leprosy can also cause ENL, erythema nodosum leprosum, which is characterized by the painful nodules along the extensor surfaces of the bones like tibia and ulna. And it can also cause neuritis, which is the inflammation of peripheral nerves, and uveitis, the inflammation of uvea, which is the layer of eye. And the drug used against ENL, which is severe, is thalidomide, which is an anti-cancerous agent, but the initial treatment for lepromatous form of leprosy is clofazimine and dapsone. We will discuss the treatment of leprosy. The first line treatment is initiated by dapsone, which is folate inhibitor, and in tuberculate form and the lepromatous form of leprosy, we will give the treatment by regime. So in tuberculate form, dapsone is combined with rifampicin. In lepromatous form, dapsone, rifampicin and clofazimine can be given for 12 to 24 months. And alternative treatment regime is that ofloxacin, fluoroquinolone and macrolide clarithromycin can be given for the treatment of leprosy.